A. Hot liquids. B. Hot solid objects. C. An open flame. D. Superheated steam. C. B. Which of the following burn injuries or patterns should make you the most suspicious for abuse? A. Burns to the forearm. B. Splash burns to a leg. C. An arc burn to the hand. D. Burns with formed shapes. D. What type of thermal burn is most commonly associated with inhalation injury? A. Steam burns. B. Flame burns. C. Scald burns. D. Arc burns. A. A. C. B. Supraglottic damage following a burn is most often caused by A. The inhalation of superheated gases. B. Exposure to carbon monoxide or cyanide. C. The inhalation of hot particulate steam. D. Direct flame exposure to the oropharynx. A. Which of the following is the least common cause of death from fires? A. Pulmonary injury. B. Integument burns. C. Upper airway compromise. D. Inhalation of toxic gases. B. A. A. The degree of absorption of a corrosive chemical determines A. The type of liquid used to irrigate the burn. B. Whether the burn should be flushed. C. Whether toxicity is local or systemic. D. The antidote required to reverse the effects. C. Dry powder chemicals, A. will react violently with water, and should not be irrigated. B. Cause coagulation necrosis if they are absorbed by the body. C. Should be brushed off the skin before irrigation with water. D. Are effectively neutralized on the skin with isopropyl alcohol. C. Phosphorus is found in blank and burns when exposed to blank. A. Fireworks, air. B. Oven cleaner, water. C. Drain cleaner, air. D. Battery acid, water. A. Chemicals such as lewisite and phosgene oxime, A. Are strong alkalis that cause liquefaction necrosis. B. Damage the body by extracting water from the tissues. C. Are most commonly found in drain and oven cleaners. D. Are vesicant agents that produce cutaneous blisters rapidly. D. Which of the following chemicals causes a painless burn and can result in significant damage before it is identified? A. Phenol. B. Sulfur mustard. C. Sulfuric acid. D. Potassium hydroxide. A. The appropriate treatment for most chemical burns is A. Application of a dry, sterile dressing. B. Flushing with copious amounts of water. C. Neutralization with an alkaline substance. D. Application of a moist, sterile dressing. B. C. A burn caused by sodium metal should be treated by A. Administering calcium chloride. B. Covering the burn wound with oil. C. Applying a moist, sterile dressing. D. Irrigating the wound with water. B. The outer zone of an entrance or exit wound caused by a contact electrical burn is A. The red zone of coagulation necrosis. B. Simply caused by local inflammation. C. A charred area of full thickness burn. D. Characterized by cold, gray, dry tissue. A. Relative to the entrance wound caused by an electrical burn, the exit wound, A, is a predictor of internal injury. B heals without surgical intervention. C is often much smaller in diameter. D can be quite extensive and deep. D. Victims standing near an object that is struck by lightning, most commonly experience blast-type injuries. B often have burns characterized by a feathering pattern. C typically experience intractable ventricular fibrillation. D experience full-thickness burns that require debridement. B. C. Damage to the kidneys following an electrical injury. A is caused by excess serum potassium levels. B occurs when damaged muscle produces myoglobin. C can be prevented with boluses of lactated ringers. D is the result of electricity passing through the kidneys. B. The two most common causes of death from an electrical injury are A. Asphyxia and cardiopulmonary arrest. B. Full-thickness burns and respiratory arrest. C. Nervous system damage and massive sepsis. D. Myoglobinuria and diaphragmatic paralysis. A. D. Which of the following locations would provide the best protection from a lightning strike? A. An open shed or lean-to. B. A spot at least 5 miles away from the storm. C. Curled up in a ball in an open area. D. A car with the windows rolled up. D. After an adult victim is struck by lightning and experiences cardiac arrest, a 5 minutes of CPR generally restores a pulse. B. Perform a compression to ventilation ratio of 15:2. C. His or her heart may beating spontaneously. D. The ECG usually shows an organized cardiac rhythm. C. The majority of victims struck by lightning, A. die within the first 24 hours following the injury. B. experience confusion and some degree of amnesia. C. require only short periods of ventilatory support. D. are permanently paralyzed due to a spinal cord injury. B. Compared to beta radiation particles, alpha radiation particles, A. have minimal penetrating energy. B. easily pass through solid materials. C. are able to travel much farther in air. D. are not dangerous if they are ingested. A. Blank radiation is very penetrating and easily passes through the body and solid materials. A. Alpha B beta C gamma deionizing. C. B. The onset of blank soon after exposure to radiation is a predictor of poor outcomes. A. Hair loss. B. Tachycardia. C. Confusion. D. Vomiting. D. Unlike chemical burns, radiation burns generally extend into the dermal layer. B. may appear hours or days after exposure. C. are typically confined to the epidermis. D. are immediately apparent after exposure. B. B. A. Upon initial contact with a severely burned patient, you must A. assess airway and breathing adequacy. B. cover the patient to prevent hypothermia. C. ensure that the patient is not still burning. D. quickly establish the extent of the burns. C. If a burned patient presents with a hoarse voice and states, "I'm cold," your most immediate concern should be a hypothermia. B. Burn shock. C. Inhalation injury. D. Cyanide toxicity. C. Patients suspected of having burns to the upper airway will benefit most from A. Unhumidified oxygen. B. Cool, humidified oxygen. C. An inhaled beta-2 agonist. D. Anticholinergic bronchodilators. B. D. A superficial burn is usually painless because the nerve endings are not exposed. B. Characterized by reddened skin with varying degrees of pain. C. Painful, but will heal spontaneously, often with scar formation. D. A second-degree burn that is characterized by blister formation. B. A. C. According to the rule of nines, an adult man with partial and full thickness burns to his head, face, and anterior chest has burns to blank % of his total body surface area. 18 bytes 27 C36 D45. A. A. D. B. Full thickness circumferential burns to the chest. A. Require the paramedic to incise the burn to decompress it. B. May cause significant restriction of respiratory excursion. C. Are generally not significant unless the skin is unyielding. D. Necessitate immediate intubation and ventilatory support. B. D. Assessment of a patient who may have been exposed to radiation begins by A. Determining if the scene is safe to enter. B. Thoroughly decontaminating the patient. C. Quickly moving the patient to a safe area. D. Evaluating airway, breathing, and circulation. A. Immediate care for a burn patient involves A. Applying sterile burn sheets. B. Establishing a patent airway. C. Stopping the burning process. D. Maintaining body temperature. C. The most acute complication associated with large body surface area burns is A. Infection. B. Hypovolemia. C. Hypothermia. D. Myclovenemia. C. Nasotracheal intubation of a patient with upper airway burns. A. Is a complicated procedure and should be avoided. B. Should be performed if the patient has mild stridor. C. Is indicated if the patient is unconscious and apneic. D. Is generally well tolerated in patients who are awake. A. B. B. D. The application of ice to partial thickness burns often negates the need to administer a narcotic. B. Is not necessary because such burns are painless. C. Offers excellent pain relief and minimizes swelling. D. Can exacerbate tissue injury and should be avoided. D. A patient with full thickness burns surrounded by areas of superficial and partial thickness burns should be treated with all of the following: EXCEPT, A. Analgesia. B. High flow oxygen. C. Moist dressings. D. Sterile burn pads. C. A. specific treatment for a hydrofluoric acid burn is A. Calcium chloride, B. Sodium bicarbonate, C. Magnesium sulfate, D. Viscous lidocaine gel. A. B. A partial thickness burn is considered to be critical if it A. occurs in any patient over the age of 45 years, B. is located to the proximal aspect of an extremity, C. is rated as at least a 5 on a pain scale of 0 to 10, D. involves more than 30% of the body surface area. D. A full thickness burn is considered to be critical if it A. is located on any part of the thorax or abdomen, B. covers more than 5% of the total body surface area, C. was irrigated with water prior to the arrival of EMS, D. occurs in a patient with a significant medical illness. D. C. B. A. B. D. C. B. A.